So I'm Peter McPherson. I'm Professor of Global Public Health and Head of the Public Health Unit in the School of Health and Wellbeing. In public health, we focus on three areas in which we're world leading. We focus on the social determinants of disease. We focus on data science and artificial intelligence and how that can be used to improve the health of communities. And in this rapidly changing world, we focus on global health and climate change. And our PhD students work across all of these areas in different disciplines. They are skilled in working with numbers and with data. They're skilled at interacting with communities and understanding why people become unwell. And they're also really skilled in interacting with the communities that we work with understanding their needs and what the drivers of disease are, but also translating that into action. How can we get governments to make the changes that will improve people's health? One of the key things that we want to do is make sure that our research addresses the needs of the community, of the people in Glasgow, the people in Scotland, but throughout the world as well. And we do that by really listening to what the priorities of people in the community are. So they may tell us that, disability or mental health are big issues, or in some settings it may be that infectious diseases are a real driver of ill health. And so we work extremely closely with the communities. We design all of our research in partnership with the communities that we work with, and we make sure that they're involved at every step along the way of the research process, including working with policymakers to understand how to get those research findings into practice here in the NHS in Scotland, but also throughout the world. So we're looking for PhD candidates with skills in quantitative methods, so statistics, epidemiology, big data, artificial intelligence are really becoming very important in public health nowadays. But also critically important are those students who have skills in social sciences, so working with communities, qualitative methods, being able to translate knowledge into action in the community as well. Glasgow is a really unique place to do your PhD. We have world-leading research facilities, supervisors with expertise across a huge range of different areas, and also experts at working with communities as well. So we've got a really strong track record at identifying new research priorities, using new innovative methods to understand disease and how it affects communities, and also importantly to translate that into policy, into the new ways of making people's lives better. We're really fortunate in public health that we have strong partnerships with other universities and other programs throughout the world. For example, we work very closely with colleagues in Malawi working on infectious diseases such as tuberculosis, HIV, malaria, but also people working to tackle the growing burden of non-communicable diseases, stroke, heart disease, disability and mental health too as well. So if someone's thinking about applying for a PhD, my advice would be to go for it. We are a very welcoming community here in Glasgow at the School of Health and Wellbeing. I would reach out to supervisors, so have a look on our website, find people whose interests align with yours and reach out to them. Start a conversation, speak to other students who are studying for their PhD in Glasgow, and you will find us very welcoming and we'll find a space here.